I'm going to start. Right. Good evening and welcome to BHealthy Winter is Here. Now I like the name, I like the sound of that because BHealthy and winter doesn't always come in the same phrase. So I think we're starting a new trend in Birmingham City Council. My name's Paulette Hamilton and I'm the cabinet member that covers adult social care and health, and I also very proudly cover public health and the well-being services in the city. And tonight I'm the chair of this meeting, so I will be asking the question, well, not asking them, but I'll be doing my bit nearer the end because Dr. Varney will be taking over. Now, just a little bit of housekeeping. The camera option, you can have it on or off, but what we've always said is, could you keep your cameras off unless you're going to ask a question? So if you're not going to ask a question, it might be better just to keep your camera off. Can I also ask you to stay muted if you're not talking, only because if we pick up any background noises, it can actually deflect from what we're trying to do. And what I'm going to ask you to do, if you've got any comments or anything, just use the chat function because we will capture all of that. And nearer the end, if you've got any questions or anything, you can use the raised hand signal because that is perhaps the best way for us to gauge the questions. But if you do have any questions that you want to ask us, please, can I ask you either put it into the chat function, but preferably raise your hand so you can ask the question and we can get the responses. Now I'm going to hand over to Dr. Justin Varney, who will start the discussion and the slide deck what's it called? Be Healthy, Winter is Here. Thank you.
Great.
Over to you, Justin.
Thank you, Cllr Hamilton. So Be Healthy Winter is Here is an update of the approach that we developed last summer. So some of you will remember after the first wave of the pandemic, we developed a series of resources called Be Healthy. And what we've done is we've looked at those, we've updated them a bit. We've listened to what people have said about a bit fed up of talking about COVID. So we're really focusing now, there are some COVID things in there, but it's more about how do you stay healthy as the winter's approaching. In normal winter, the NHS and social care are put under a lot of pressure. As it gets darker and it gets colder, people have more accidents, our mental health suffers, and many chronic conditions like lung disease, asthma, heart disease get worse in the cold. So that already puts extra pressure on the NHS and on social care. And this year they're still battling with COVID. And sadly, COVID is still putting people in hospital. And although we've got the vaccines, there's still a lot of challenges in the system. So it's really important we all play our part in looking after ourselves this winter and making the most of what we can do as individuals. And that's what's really at the heart of Be Healthy Winter is Here. It fits as part of our new vision for a bolder, healthier Birmingham. And I'm not going to dwell too much on this, but saying that there is a real refreshed appetite, both in the council and across the partnership of the Health and Wellbeing Board, with our partners in the NHS, in the voluntary sector, in the business sector and with the universities of the city to make a real difference and to see a step change in the way that the city supports people to live healthier lives. And this is part of us kind of stepping into that space a little bit more as winter is here. Be Healthy Winter is Here it's a simple checklist of practical things that everyone can do. And although it's got a bit of COVID in there, as I said, the bulk of it is not about COVID stuff. And the next couple of slides are the bulk of the tools. So there's a short tool, which is only 4 pages long, that you'll be able to print off from tomorrow, downloaded from the website. There's a colour version and a black and white version, depending on your printer and what you want to use. And there are also extra resources which give you more detail about some of the hints and tips and where you can find out a bit more. I'm going to talk through some of those in a little bit. So the first bit of the toolkit is a checklist for things that we can all do and kind of you do at once. So this is not something you keep doing every week. It's something you go through once when you get the toolkit and go, yeah, have we got our flu jabs? How are we up to date with our COVID vaccines? Do we have the medication we need to get us through winter? If you've got a long-term condition, you're used to doing repeat prescriptions, but this time of year, leave a little bit of extra time. The last thing the GPs need is people ringing up and hassling receptionists because we didn't get our repeat prescription requests in early enough. And now we've only got a day or two of medicine left. So plan that kind of stuff will make a big difference for people. There is funding available and there is support available for some people around things like winter fuel bills. So checking, are you eligible? And there's some great resources online through also the voluntary and community sector can support people and advise how to navigate the benefit system. We know it's all got a little bit more confusing since universal credit. So it's really important to just see, am I entitled to anything that I'm not getting, and will it make getting through the winter just that little bit easier with the fuel bills? The other thing that's important in the checklist is thinking about emergency numbers. Yeah, unfortunately, winter is the time when pipes break, things leak, and actually just having in one place your details for your insurance, the plumber, those kind of things, it's really sensible to just get that stuff ready before you need it, because it really does make it a lot less stressful when it happens. I did say we keep a bit of COVID in there. So thinking about, have you got your lateral flow kits ordered? Have you got a box at home ready to use? Have you got plenty of face coverings for going out and doing the shopping trips? Have you got a bit of extra food in the cupboard? Just a couple of extra tins of soup or packets of biscuits to see you through if you need to isolate, or if the weather gets really treacherous and it's hard to get to the shops. And have you thought about any friends or family that need a bit of extra support at this time of year? So this kind of checklist is designed to kind of go through with someone once. And we've designed the Be Healthy This Winter tool as something that people in the voluntary and community sector can use with clients to go through and help them think about how they're planning to make it through the next couple of months when the weather's a bit bad. So you could use this as an activity with a group or with an individual, or you can fill it in yourself at home with your family. The second part of the checklist is something to do every week, and it's really designed as something that you tick off every day. Have I done at least 10 minutes of physical activity and got a bit warm? Have I talked to someone I care about? Have I eaten 5 portions of fruit and vegetables today? Did I brush my teeth twice? One of the things that most of us are not so good at. Did I wear a face mask when I went to the shops or on the bus? Have I said thank you for something? Did I wash my hands when I got in? Because we know that washing your hands is a great way of killing off those germs, not just for COVID, but also for things like diarrhea and vomiting bugs that are around this time of year. And did I get a good night's sleep? And by using this weekly activity checker, you can kind of keep a track of when you have good days and when you have bad days. We're not perfect. We're not all going to have a tick every day, 7 days a week, but it does help you get a sense of if something isn't going quite the way it should. The final page of the toolkit is just one that highlights where you can get more information, and that will signpost you through to this longer slide deck, which will be a PDF on the website. And we are getting the long slide deck translated into multiple languages as we did last time, and those should be ready in about 10 days time. So this is the bit that's a bit more detailed, and this is where you can go if you want to try and fill it out a bit and understand a bit more about what we're trying to advise you to do. So the first section of this is around keeping healthy in the cold. Winter's a time when we do let things go a little bit, and sometimes we can get a bit tempted by all the extra treats and all the things that tempt us to stay on the sofa sitting in front of the TV. So actually taking simple steps every day, like a brisk walk or not having treats every day, can make a big difference. It can also be a time when you want to make a big change, particularly coming up to the new year. And there is support available for people who want to give up smoking or are struggling with problematic drinking or drug use. And the toolkit's got some links in it about where you can get free and confidential support and advice. So we've included it in more details on things like being active every day and helping connect people to some of the resources that are out there, both the national resources like the NHS Live Well website, but also local resources like the Sport Birmingham Activity Finder, where you can go in and search for activities based on your age, your gender, disability, or also just particular areas of interest. So it's trying to give people options, but also help them connect them to support that's available. The next slide's about balancing your plate and keeping the treats to treats. This is a time of year where people don't want to be nagged about having the chocolates around the Christmas tree or avoiding the Christmas cake. And what we're trying to say is it's not about banning the fun stuff, but it is about finding balance. And actually, if you can find balance so the treats are things that you just have once or twice a week rather than every day, that will make quite a big difference. And using tools like the Eat Well Guide or the Change for Life resources around smart swaps for menu tips and recipe cards can all make a real difference to your health during the winter. If you are contemplating the big changes, then please get help. There's lots of free support available out there in terms of helping people to give up smoking. And in Birmingham, we fund an additional app that's free called Quit with Bella. And this is quite a clever app. It's evidence-based and it personalizes its advice and its responses to you as an individual. As you use it, it starts to learn when you need help, when you need tips. So it's a great resource for people that are trying to quit but haven't got time to go to a group or pop into the pharmacy every day for a conversation. Quit with Bella can be a really helpful way to quit on the go amidst the busyness and chaos of the festive season. If you're having problems with alcohol or with drugs, then we have Change, Grow, Live, CGL, and they're there to support people who want to make the change. We now have community hubs across the city where they're seeing and supporting people. So it's not about having to trek into the city centre anymore. They are out there across Birmingham, creating spaces where people can have conversations and start to make the journey out of addiction and into a better relationship with alcohol and drugs. There are also national helplines, which we've included in the pack as well, that people can draw on for support. One of the other things we included in the pack is some tips about just thinking about things you can do that you can prepare for winter. One of the challenges of this time of year is that the weather really fluctuates. We can go from sun over the city to snow in a day. And certainly living in the centre of Birmingham, I've lived through 3 seasons in a day last winter. So I know how quickly it can change and how quickly the snow or rain can come in across the city. So just thinking through these simple things around preparing yourself, preparing your home and preparing any transport you have can make life a lot easier if the weather does turn bad. It sounds stupid, but these are often the things that people forget until it's the last minute. So things like having your emergency contact numbers in one place, things about stocking up the cupboards, using things like curtains at night across all the windows and keeping the doors closed inside can really help keep warmth up in the house, particularly as we all struggle with energy bills with the winter coming in and some of what's going on in the energy market. And if you have a car or a bike, now's the time to check it. Check the brakes, check the lights, check the windscreen wipers. And there's a great checklist on the Met Office that we've linked to in the resource that gives you a really useful way of thinking through, particularly for a car, all the things you can do yourself without having to take it to a garage to make sure that your car is ready for the winter. We really wanted to talk about mental health as well in the winter months, because when it gets dark and cold, it's harder to see people and often our mood does drop. So making the effort to look after your mind is just as important as looking after the rest of your body over the winter months. Staying connected is really important. Whether you do it face to face or you do it through technology, it's important to have a conversation at least once a day with someone that you don't live with, because it gives you that extra boost. And we know from the evidence base, the research, that connection is a really important part of our mental well-being and resilience. So take advantage of the festive season. Whether you send Christmas cards or Yuletide celebrations or Hanukkah cards to people that you don't talk to regularly, use it as an opportunity to reconnect, to make a connection with someone. You could go a step further and connect with someone who's a stranger who might be lonely and needs befriending. And using one of the national befriending or pen pal charities is a good way of keeping yourself safe, but also providing that support in a way which is appropriate and is safe. It protects you as well as supports them. But it is a really great thing to do at this time of year, because there are lots of people across the country who find Christmas and the festive season a really lonely time. And actually getting a letter, even if it's from a stranger, can really make the difference to their day, their week, and quite possibly their year. The brain, like any other organ in our body, does actually need looking after. And I think we probably don't think about the brain in the same way we think about our muscles or our lungs, but actually there are things that we can all do which keeps the brain as an organ a bit healthier. And this section just gives some tips and hints about things that we know the evidence shows keeps your brain healthy, keeps the cells of your brain healthy, keeps it in tip-top condition. And there's simple things we do every day, whether that's learning a new skill or doing a word search or a puzzle, keeps those neurons firing, the electrical pathways of the brain functioning. Physical activity is really important for your brain because actually your brain is one of the biggest consumers of oxygen and of sugar and chemicals in your body. So you need to keep your muscles moving so it pumps blood around your brain and keeps your brain fully supported by all of those nutrients it needs. And avoiding things like tobacco and alcohol really make a difference because the chemicals, particularly in tobacco, can be quite damaging to your brain cells and really slow down the way your brain functions. So it's useful to think about your brain as the same way you might think about building up your biceps or working on your lung capacity as something that you should be thinking about every day. Finally, in the mentally healthy section, we talk about sleep. Sleep's something that I think most of us know is important but don't really invest in, particularly during the festive season when there's always a party or there's always a good film on TV. There's a reason that we should stay up that little bit later. And unfortunately, we lose sleep. And because we keep doing that, gradually we're building up more and more challenges for our body. Sleep is really essential. It's the time which our body uses to rebuild itself. Think of it a bit like our body's a rechargeable battery. And if we don't plug it in to recharge every night and sleep properly, then it can't charge back to full. And if it doesn't charge back to full, each time it's getting lower and lower and lower. And that's what's happening with our body if we don't get a regular amount of sleep. So these kind of sleep tips are really helpful in terms of balancing your sleep and getting a good night's sleep just by making some small changes. And I have to say, from personal experience, I know some of these really do make a difference and do work, even though they sound really simple. The next section is about being in control of your conditions. As winter draws closer, people with long-term conditions like diabetes, chronic renal disease, ischemic heart disease often find things get a bit more challenging. Some of that's about the weather and some of it's about just the whole pressure of Christmas, the extra stress, the way that meal times move around. All of those things can make it a bit harder to manage your health during this period. So thinking about if you've got a long-term condition, have you had your routine checkup this year? Most long-term conditions like kidney disease or lung disease, you should be having an annual check with your GP or with the clinical pharmacist at your GP practice to go through your medications and check that you're on top of your health conditions. That can be really important because every year we're learning something new, particularly around conditions like diabetes. And the advice for diabetics now is quite different from where it was a few years ago because we're getting better at understanding the condition and what people need. Early diagnosis and good control are really important, and actually using things like the pharmacy blood pressure machine can be a great way of understanding is your blood pressure going through the roof, and that's why you've got headaches or why you're feeling very fatigued. Getting your prescriptions on time I've talked about before, but I cannot stress it enough. As many of you know, my husband's a local GP, and the amount of times that he comes home from work and talks about patients who've been stressing out the reception staff because they only put their repeat prescription request in the morning and they need it that day because they've already run out of their pills, and that just stresses everyone out. So really think about how many pills have I got left and leave at least a week to get your repeat prescription request in, so there's plenty of time for the GPs to turn it round. The final point on this slide, which I think is important, is if you do have a long-term condition, do your family and friends know what to do if things get worse? Often we know our bodies best and we know the signs when things are getting bad, but it can be really difficult to have that conversation with people we love because we don't want to worry them. But actually, if you explain what your signs are when something's getting bad and what they can do to help, whether it's getting you a sugary drink, propping up your feet, bringing you your tablets, those are the kind of things that if they know what to do, they will feel better if things start to go wrong and they'll feel they're able to support you. So having that conversation can be really, really helpful. The next section is about protecting yourself, and this is about thinking about what you do as an individual, but also some of the things you do in your house around you this winter to protect people that are coming to visit you. As I said, the NHS is under a lot of pressure, so the more we can do ourselves as individuals, the better things will be for them. Vaccinations are really important, so it is time to grab a jab, and that's not just the COVID vaccine. You can get a flu jab as well, and you can have your flu jab and your COVID jab together if you're having it on the NHS, if you're eligible. If you're elderly, it's also important to get your pneumococcal vaccine and your shingles vaccine. Anyone who's had shingles will tell you it's a really, really painful condition. And in the elderly, those over 65, it can be really, really nasty and actually get quite complicated. So the shingles vaccine is another way that we can protect ourselves against something which is easy to catch and really nasty to have to put up with. So getting your injections in time is a really important thing we can all do that reduces the pressure on the NHS. The other thing that we can do, which really helps, is think about who to ask. I think many of us think actually the right person to ask when we've got a health problem is the doctor, and we need to go and see our GP. And there are lots of other healthcare professionals out there who are really well trained, and in some cases better than your doctor in terms of giving you the advice in a way that you can understand and apply in practical terms. Pharmacists, for example, are brilliant at common things, rashes, bumps, lumps, bruises, particularly good also at questions about babies and small children, because they've got a lot of experience in giving advice, and it's also part of their training as well. They can also help you understand the side effects of medication. So if you're worried about your tablets, pop into your pharmacist and have a chat with them first before you go and see the GP. They might be able to help you, and they really do understand medicines. There are other healthcare professionals that you can see, nurses, healthcare assistants, and don't forget your dentist is also a qualified healthcare professional. They spend almost as long at dental school as we spend at medical school to become doctors, so they're a great place to get advice and support as well. If you have an emergency, you ring 999 or go to your nearest A&E department. But if you need help and it's not an emergency, you can contact 111 or go to 111.nhs.uk. And that's for the things in the middle of the night when you think it's not really ambulance time, but I'm really quite worried about what's going on. And other times, having a chat with your pharmacist or going to see your GP or dentist, but also do a bit of research yourself. I think this is one of the things that we always forget, is that there's a lot of information now available, but please go to trusted sources. Don't listen to some bloke on a sofa on YouTube. They're probably not a qualified medical professional. Go to the NHS website, which has a lot of information now, A to Z information on different health conditions, but also A to Z information on different medicines. So always do a bit of research yourself on the NHS website. The other places that I would trust to look for information are national disease charities. And there's a group of these, things like British Heart Foundation, Cancer Research UK, the Alzheimer's Society. Go for the national ones because you know you can trust them, and they all have doctors working for them who verify the information before they put it on their website. You can also access information through the council website, and we have more information now on the council website public health pages to help you access support and information about your own health and well-being. And these slides will be going up on a new section of the website that will go live tomorrow for the Be Healthy resources, and that will help connect you to other bits of information where the council's gone through and made sure that the sources are accurate and are appropriate ones for advice and support. Finally, there's information about how to keep a bit more COVID safe. You know, one of the key things we can all do is ventilate, but at this time of year, it feels really bad to be opening the windows because it's cold and wet and not very nice weather. But just thinking about how you do these things practically, if you've got friends coming over, opening the windows for 5 minutes before they come will make a real difference to reducing the COVID risk. And after they go, open the windows again for 5 minutes and just air the room through, air the house through. All of that reduces the risk of COVID hanging around like a bad cloud in your sitting room and causing risk to you and your family. Washing your hands is really important, not just for COVID, but for all the other bugs that go around at this time of year. Things like respiratory syncytial virus, which is a viral illness that affects small children, can be quite nasty, and it also very nasty for the elderly. Washing your hands with soap and water kills it and gets it off your hands and stops you bringing it in home. Wearing face coverings are about protecting you and protecting the rest of the world from you. So it's a simple thing that we can do to just mask up and keep each other safe. And keeping testing regularly is important. Even if you're vaccinated, particularly with the new variants, there is a risk that you can still catch COVID and you can still pass it on. By taking a test twice a week at home with the lateral flow test, when you haven't got symptoms, you'll just get that extra bit of safety and security that you haven't caught it and you're not passing it on. If you have symptoms, it's really important to stay at home, to isolate and to order a PCR test, and not to leave home until you get the result of your test. Because sadly, we are seeing people still getting infected with COVID and still passing it on to others. We stop this infection spreading through the things that we all do every day. So these are simple steps that we can take this winter to keep everyone safe. Finally, we're including a bit of fun stuff this year. It is the festive season, and we know many of you will be looking for things to do with friends and family. So we're developing a series of things like word searches, where you can find words that are relevant and relate to what we're trying to get across in terms of messages. We've also got some dot to dots, and we've also got some fun mazes as well. And we'll be building some of those resources over the next week or two on the website to keep giving you stuff that will keep this alive and engaging for your friends and your family, and help us keep everyone safer and that little bit healthier this winter. So I hope that's been a helpful presentation and gives you a sense of what we're going to be covering through the Be Healthy this winter, and happy to take any questions anyone has for us. Does anyone have any questions they'd like to ask about the presentation or what I've covered?
I'm ever so sorry, Justin. Those on the call, I want to. Is somebody asking a question, Justin?
No, it was Jill from the Disability Resource Centre saying it was a very helpful presentation. Thank you, Jill.
Any other questions? I thought it was very good. Just so that everybody knows, and me killing this vibe completely, I won an award yesterday and my phone has been like New Street Station. And can I say publicly, could not have done it without that big man there on the other side. He has been an absolute star. We've been like husband and wife over the last 18 months, but it has been nice. But we'll go back to business, which is be bold. What is it?
Be Healthy Winter is here.
Be Healthy Winter is here. Come on, we must have one question. None at all.
I'll get rid of the question.
Come on, you know, I'm in a good mood.
I know what it's like sitting on the end of these screens when nobody's talking to you. Just a question really about the resources and things. I presume because it's all going on the website that it's all just available for general purpose. Obviously, we get a lot of people coming into the Disability Resource Centre, and we're seeing a lot of people who are digitally excluded at the minute. So are we just at public disposal to kind of draw all those resources down and share out as much as possible?
Yes, absolutely, Jill. And what we've also done, Thomas and the team have been going through the deck to make sure it's disability accessible for those that want to read it with a web reader.
Yeah. Is that kind of resources that we need to print off ourselves, or will there be any kind of packs available? Or
so at the moment we're not planning on printing any packs, partially because the council has a kind of don't print policy. What we have got is the shorter version, which is the grids, the worksheets. That's just 4 pages, and we've made that black and white, so it's cheap and easy to print off. And then the bigger colour slide set that has all the web links in. In general, I wouldn't recommend printing that for people. It's there for you to be able to pull off and use when you're talking through with people. But the 4-pager is simple. It's black and white. and it's designed to be cheap and easy to print off.
Well, just following on from that question, Jill, that's a very good question. Will we be sending the packs out or via email to any organizations? I don't mean the hard packs, but via email. You know, we've already got a database. Will we be sending it out to our database?
Yes, so the plan is that probably the beginning of next week, when we've got all of the resources online. So tomorrow the website goes live with the ones we've shown you tonight. The translated resources will go up should be middle end of next week. They're with the translators, they're going in the morning. That then we'll put out a big cascade email to everyone to say this is now live and all the translated resources are there as well, to help encourage people to use them. Alongside that, we'll be using the social media accounts as well, so that the Healthy Brum media accounts to get messaging out about it, and also working with our neighbourhood networks so it cascades out through the neighbourhood network schemes as well. Because the idea is this is really very much something to help both citizens directly, but also organisations like Jill working with citizens to use something that's really simple to try and help kind of crystallise what are the key things that people can do this winter, just keep themselves a little bit safer and a little bit healthier.
Yeah, absolutely. We have got a meeting on Tuesday with the neighbourhood network community officers from across the city to train them up as energy champions across the city. So looking at how we can reduce that fuel poverty. So I just want to make sure that I kind of include that in there as well, and that's a resource they're aware of, and that everybody's just kind of singing from the same song sheet, really. Thank you so much.
Are there any other questions? Come on, just one more question and then I'll let you all go. Just one? Nasmeen?
Yeah. No, I have no questions. I think Justin's done a fab job in explaining the Be Healthy presentation. Thank you, Justin.
Right, so if there are no questions, you've had a lot of time to ask. I think we'll have a early finish. And so on that note, as I'm getting it wrong all the time, so I'm going to find the title. And what's the title, Dr. Varney? What is the title of this session?
So it's Be Healthy. Be Healthy Winter is here.
Right. So as I've got no more questions for Be Healthy Winter is here, can I say have a great onward journey? Can I say to Justin, wonderful presentation. Keep well over this winter. If I don't see you before, have a wonderful Christmas and any other holidays for any other faiths leading up to Christmas. And please do not drink, if you drink, too much at the new year, but enjoy it. And we'll do this all again soon. It's been an absolute pleasure. Thank you and bye-bye.